Good afternoon, everyone. This is CB Mamarel, and on behalf of the National Coordinating Center, I would like to welcome everyone to today's PHSR Research in Progress Series webinar focusing on the cost, quality, and value of public health service. And so we're excited to have two presentations today for today's webinar. Our first topic will be on using PBRNs to identify nuisance inspection services, cost, and quality. And the other presentation will be a PHSR translational toolbox. So just to remind everyone that you can download today's presentation and speaker bios at the upper right-hand corner of your screen if you see the resources box in the top right corner of the screen. So also during the presentations, feel free to type in your questions in the chat box, the lower right corner of your screen. So just to give everyone an overview on the flow for today's webinar, I would like to introduce first our speakers. And since it's unique that we have two presentations today, what I'm going to do is to ensure a seamless flow from the first presentation to the next presentation is I will introduce all our presenters for both presentations, including our commentators. So after I do that, then we'll start, of course, with Dr. Frank and Dr. Orcena's presentation, and then we will also have the commentary afterwards, and then move on to Kristen's presentation with the PHSR translational toolbox. So it is our pleasure to introduce our first two presenters, Dr. Scott Frank and Dr. Jason Orcena. Dr. Frank is Associate Professor in the Department of Epidemiology and Biostatistics, School of Medicine at Case Western University. Scott directs the Master of Public Health program and also holds an appointment in family medicine. He is also on the affiliated faculty for the Schubert Center for Child Studies and for the Prevention Research Center for Healthy Neighborhoods. Scott leads the Ohio Public Health PBRN and is also director of Health City of Shaker Heights. Scott is involved in a broad variety of research, including topics such as behavior change, tobacco prevention and control, substance abuse prevention, clinical assessment of stress, adolescent health risk, and the role of spirituality and religion in health. Dr. Frank maintains an active family practice and is an award-winning teacher of residents, medical, and public health students. He is currently the curriculum lead for the innovative CWRU SOM Population Health Curriculum. Dr. is Health Commissioner of the Union County Health Department in Ohio. Jason has worked for the agency since 1998, serving as commissioner since 2008, and previously as the director of the Health Education and Community Partnership. Dr. Orcena represents Union County and the Health Department in a variety of settings, including as past president of the Ohio Public Health Association, chair of the Regional Impact Committee on behalf of the State Department of Job and Family Services, and AOHC Futures. Currently, Jason serves on the board of the Association of Ohio Health Commissioners, the board of directors for the Health Policy Institute of Ohio, and is president of the Ohio Local Public Health Services Collaborative, LLC. Jason holds a master's degree in sociology from the Ohio State University and a DrPH from the University of Illinois at Chicago, where his research focused on the roles of networks on the cost of delivery for core public health services. To comment on their presentation, we have Chris Kippis, who is Director of Epidemiology, Surveillance, and Informatics Services at Cuyahoga County Board of Health. Mr. Kippis leads the Board of Health's efforts to collect and monitor the amount of infectious and chronic diseases in the community. Additionally, at ESI, also leads the agency's emergency preparedness planning efforts and provides technical support for agency programs such as data analysis and public health informatics support activities. For our other presentation with the PHSR Translational Toolbox, this will be presented by Kristen Mikolowski, who is a research associate at Health Resources in Action. Kristen conducts both qualitative and quantitative research with a focus on analyzing data to help health departments, hospitals, health centers, foundations, and other clients identify priorities for programming, policy change, and funding. Kristen has an extensive experience collecting and analyzing qualitative and quantitative data, conducting literature reviews and environmental scans, writing technical reports, and disseminating information to diverse stakeholders. At Health Resources in Action is a national public health and medical research organization that works to help people live healthier lives and create healthy communities through prevention, health promotion, policy development, and research. It is also a member institute of the National Network for Public Health Institutes. So with that, I'd like to first turn it over to Scott and Jason for their presentation. You have the line. Go ahead, Scott. You're on.
Hi, this is Scott Frank, and I'll be doing the presentation today. Jason is on the road, so doesn't have access to the slides as we're going. He may be able to contribute during the discussion, but I'll be taking the driver's seat for the presentation. Thank you for having us here. I have no conflict of interest to disclose. I will disclose, however, that CB's bio is a little bit out of date. I no longer am serving as the population health lead for the medical school curriculum. I've passed that baton on to my colleague Heidi Gullett. So to move forward with the presentation, we've placed a large focus on nuisance inspection and abatement in our project, and I'll be sharing those results with you today. Plato is among the first to advocate for nuisance inspection and abatement. As he said, habits of transgression formed from repeated petty misdeeds can ripple up to bad effect in polity. The purpose of this project is to examine the process, cost, and value of mandated local health department nuisance inspection and abatement. And what we'll be doing today is describing the nature and content of this process based on direct observation of nuisance abatement and to some degree on abstraction of available nuisance abatement reports, and then to identify time and cost in total and in component dedicated to nuisance inspection and abatement in these health departments. Finally, to discuss the perceptions of the value of nuisance inspection and abatement. Nuisance inspection and abatement is mandated, unfunded, essential public health service. It often represents the face of public health to the local community, and it is the most likely way in which health departments interact with other governmental departments. A public health nuisance is considered a condition or activity that involves unreasonable interference with the community, including safety, health, morals, and comfort. And the intent is to prevent uninhabitable conditions and to control the spread of disease. Conditions, historically conditions that may cause sickness, disease, and filth. The steps in nuisance enforcement include the identification of the nuisance, the investigation to declare a nuisance, to abate the nuisance, and to develop policy to control a range of potential nuisances moving forward. When there is contention around nuisance abatement, it is civil rather than criminal consequences that are pursued by local governments. Nuisance abatement fits into the realm of broken window theory. I think most of you are aware of this approach. An unfixed broken window leads to decay, disorder, which in turn leads to social disorganization, increased criminality, and impaired health and safety. Those who live in a broken neighborhood tend to leave it broken, leading to greater levels of crime and particularly civic disinvestment. In other words, if we take care of the little things, the big things will take care of themselves. Broken window theory is based on social disorganization theory. Social norms change, are based on level of disorganization, and there are metrics for measuring broken window. The Broken Windows Index has been demonstrated to be associated with a variety of different problems in neighborhoods. One study independently predicting neighborhood gonorrhea rates based on the Broken Windows Index. In essence, root causes matter. So this is the direct observation of nuisance abatement, or the DONA study. It is a comparative case study with mixed methods, including interview, direct observation of service delivery, abstraction of nuisance abatement and inspection forms, and time studies that were conducted to measure the actual delivery of services. We trained 7 student observers who partnered with 27 environmental health specialists across 6 diverse Ohio health departments. Each health department provided access to the student observers during all steps of the 167 nuisance inspection and abatement procedures that they examined during this period of time. In addition, they abstracted information using the same basic form that was used for observation, 509 nuisance inspection reports that had been conducted during the past 12 months. We developed an observational protocol through focus group and Delphi process that allowed us to know what to look for in these focused observations, in these direct observations. Inter-rater reliability was demonstrated using this process in previous research, but no formal inter-rater reliability was conducted on this particular study. We have used direct observation, data abstraction. I've said all of that. We'll go on. These were the sites that the observations took place in. And in doing some of our calculations, we worked with the median salary for public health environmental health technicians from 2010 of $41,000, and with the presumption that an environmental health worker benchmark was 1 per 25,000 population. This is a brief description of the environmental health specialists that we work with. 56% were male. There was an average of 15 years working in environmental health. And you can see how their time was divided within their role. Sorry, there's a little repetition on this slide, but further description of this group says that 70% conducted 10 or more nuisance inspections within the past 2 months. 26% had conducted more than 60 during that past 2-month period of time. 10% spent time of time. 10% of their time they considered to be spent on nuisance inspections. They estimated that 37% of the time spent on nuisance abatement was involved with, not in the field, but with paperwork or communication regarding nuisance abatement outside of the time of the interview itself. This area has not really been looked at to any great extent, so even basic descriptive statistics are useful here. These are the categories of complaints that we worked with, both from the literature and from our Delphi process. And you can see that the top nuisance abatements involved property, animals, garbage or solid waste, water, air, and then down to fewer for insects, sewage, and others. Small but significant number, because of its importance, revolved around toxic or hazardous exposures. This is word cloud that gives a little bit more of a picture of what it is that our student observers saw. You'll notice especially big words like infestation, rodents, rats, odor, feces, apartments,